Good morning, everyone. Thank you for coming, Dr. Fury, our old friend here. We're going to just try and touch on the topic of autoimmune disorders. I'm only going to try to present a very high off the ground idea about what the autoimmune diseases are classified as, how many people it involves, and how it affects the everyday life of the people, and how we can care for them. Autoimmune disorders affect approximately 80 million people, whether they're asthmatic related, respiratory related, tissue related, allergy related, or alike. And as Dr. Minion mentioned, our body uses some sort of an antigen and develops an antibody reaction to it. Whatever we are responding to, whatever it comes in contact with, whether it's an inner failure of design by genetic predisposition, or it's some sort of an external cause that creates and turns on that gene or turns on that activity, it binds to that antigen and starts to attack it. So it's the autoimmune immunity is basically our body is attacking itself based upon what it recognizes as foreign, but it turns out to be the patient's body itself. There are approximately 80 different types of autoimmune disorders, and the definition and the classification is ever expanding as we are learning more and more in detail of what it involves and what it doesn't. Overall, it involves anywhere from 5 to 8% of the population. It is prevalent in developed countries, not as much in developing countries or third world countries. It can be found in every organ system of the body. It can be found anything from our musculoskeletal to our vascular to our digestive to our neurological, central nervous system, or and the diagnosis of autoimmune disorders and the treatments is very vast. We not only have to rely on our rheumatologists, associates and partners and neurologists, as well as gastroenterologists that will have to deal with the day-to-day side effects of these diseases. Autoimmune disorders are very difficult to deal with. A lot of time they are lifetime disorders. There is a lot of time no cure for what we're trying to suppress. It just becomes that we are able to control the symptoms or put it into remission for some time and then use drugs that are, unfortunately, some of them have side effects themselves that cause other damages to other organ systems. It's a devastating disease in a way that it affects families. When one or more member of a single family gets affected, the whole family economically collapses or becomes in distress, because not only they have to care for that family member, they also have to deal with the loss of income and mood disorders and whatever else that goes along with it. A lot of the autoimmune disorders seem to be gravitating towards women more than men, although some of them are more prevalent in men. For example, lupus and MS tend to be more prevalent amongst women in their 20s into their 40s, and but it can be any age, any sex. It doesn't really have to have a predisposition to anything. Diabetes, ankylosing spondylitis, and myocarditis is more prevalent amongst men, and rheumatoid arthritis and thyroiditis, which is again the body attacking either the joints or the thyroid gland, tends to be more prevalent amongst older individuals. There are some ideations and some theories and some studies at work that say that there are not only environmental factors involved in why there is more affecting women, but there's hormonal factors. Hormonal factors that may be estrogen driven or progesterone driven or somewhat, and that may be the key why women may be suffering from it a little more than men would. These can be inherited disorders. They usually are amongst close family members, and they are um, uh, in clusters if they do happen. There are many causes for autoimmune disorders. Whether there's a genetic predisposition, there's drugs, there's infections, there's iodine, thyroid diseases, environmental triggers, and so on and so forth. Just as an overview of what autoimmune disorders are and what the most common causes of autoimmune disorders that we are seeing, or the most popular types, lupus, which Dr. Fury is going to give us a more in-depth talk on, seems to be able to affect almost every body organ part as possible in different manifestations. It is more common in women again. The ages are between 10 and 50 years old. And there's always, with autoimmune disorders, we always have some sort of a chronic pain, joint swelling, low-grade fever, malaise, lack of thrive, fatigue, chest pains, swollen glands, lymph node involvement, as well as having memory problems. Rheumatoid arthritis as a whole is much like lupus, can affect every body system. But it is particularly focused on the lining of the joints where it seems to be affected the most. Fingers and hands and extremities are more affected, deformities are more involved. Again, maybe a little bit more predisposition towards women, a little bit older, after the age of 40, seems to be the cluster. As a sample of a GI disorder, Crohn's disease and ulcerative colitis, which have become very popular in finding and treating, is the same autoimmune disorder now attacking the lining of our digestive tract. So the digestive tract becomes inflamed, becomes sick, becomes ulcerated, and it starts to shed and it starts to react in different ways. And through rectal bleeding or through bloating and pain and diarrhea, we may be able to try to pinpoint and differentiate after endoscopies and genetic testing or chemical testing or markers, be able to pinpoint where, why. And a lot of these diseases, again, have many different organ systems involved. So you could have a GI presentation, but have musculoskeletal presentation and have problems with your eyes and have problems with your mucous membranes and so on and so forth. One of the autoimmune disorders that is mostly affecting children seems to be diabetes type 1, where the body attacks the cells of the pancreas, which produces the insulin. And by attacking the pancreas, it dysfunctionizes and there is no more production of insulin in the body. It's usually discovered in the young children, is discovered because of their failure to thrive, or they have frequent urination, they have weight loss, they have sores that don't heal, and so on and so forth. But it's a major problem, but it's what we are seeing as a type 1 is that these people are unable to produce any insulin on their own. Another type of autoimmune disorder that is common is thyroiditis, where as the body attacks part of itself, here the thyroid gland. Hashimoto's thyroiditis is an example of that. Basically, the body figures out some sort of a viral infection may be the induction of this immune response, and it may create the attack. It may cause the thyroid to become hypo, or euthyroid and travel back and forth in phases and different timelines. It comes along again with joint pains, comes with fatigue, comes with headaches, comes with depression, mood disorders, weight gain, weight losses, constipation, diarrhea, whether it's a hyper or hypo, you can experience many of those symptoms. Also, irregular heart rate is very common to see amongst those. There are other types of autoimmune disorders that affect our lymphatic systems. And autoimmune lymphoproliferative symptoms are another subset where the blood cells are accumulating, the white blood cells are accumulating in the lymph nodes and causing large glands and inflammation of the joints and swelling in the lymph nodes of the neck, in the groin, in the armpits, and so on and so forth. Another class of autoimmune disorders are vasculitis. Vasculitis basically is affected by anything that is affected by the inside the lining of the arteries and the veins will be deemed as a vasculitis classification. Again, they could have headaches, fevers, fatigue, general aches and pains, as well as weight loss, rash, night sweats, numbness and weakness, and limbs that you may have lost a pulse on one limb versus the other because it affected the arteries or others. Other types of autoimmune disorders could be things that have more inflammation, like but in the mucous membranes, Behçet's, which affects the mouth, the eyes, the genitals, ulcers, and the other also affects the hands and the feet of the general the patients that are affected. There are many types of different autoimmune disorders, but we try to somehow come up with a diagnosis through some blood examination of the blood as well as examination of x-rays and so on and so forth. A lot of time we see a normochromic, meaning a normocytic anemia, which shows that the patient doesn't have an iron deficiency, but it shows a long-standing inflammatory process going on. A lot of times you may see leukopenia where the white blood cells counts are dropped, and you may see thrombocytopenia where the platelet counts are low. We will also can use coagulation to try to differentiate different types of disorders and how they fall into one category or other, whether the patient has some traveling antiphospholipid antibodies, some hypercalcemia, prolongations of coagulation, and whether or not there are, the mixing studies come back as positive or negative for any anticoagulants. Next, we use a simple urinalysis to see whether or not there is evidence of red blood cell, white blood cell proteins in the body, and if there are any sediments or cast or dead kidney tissues that are evident. There is many inflammatory markers in the toolbox. ESR or sedimentation rate is a very popular opening of the door. You look at the sedimentation rate just to see the level of the inflammation. C-reactive proteins is another one that is also used. It's a sensitive, also used to try to either help make the diagnosis or help assess the treatment stages and the response to the treatment as much as possible. Another marker is ferritin, which is another acute phase reactant, which could go up. Everybody thinks that, some people may think that ferritin, iron, it has to do with iron, but it has to do with inflammation in the body as well. So it may not be up or down because of anything but inflammation. There are rheumatoid factors, which is sensitive about 70% of the time to help the diagnosis of rheumatoid arthritis, and specificity and sensitivity is about 70% for rheumatoid arthritis. But there is about 15 to 20% of people who are negative rheumatoid factor, which will have a disease or have a disease, and about 15-20% of the population who have the marker but don't exhibit the disease. But again, if these are positive, you need to be careful because it's on the way. You should expect the disease to come, so you have to be on the lookout to try to catch it before it arrives, hopefully before doing any damage. Another type of test that we run is called an anti-nuclear antibody or an ANA. Again, these open the doors to different kind of diagrams or charts, if you would. If this is positive and this is negative and this is low and this is the direction it's going to take us. So another very specific or very marker is called anti-double-stranded DNA antibody. And this is used to diagnose and to monitor lupus as well. Antibodies, it is also present in other, but it is very specific for lupus. Again, we have autoimmune disorders attacking your kidneys. So we have markers that are designed for tissue, for the kidney. So ANCA, P-ANCA, and C-ANCA are some examples of that. The other thing that we can use is another marker called serum complement levels, which basically tell a story of where our system complements are, whether they're working or not, whether the levels are low or high, or the ratios are in the right direction or they're not. There is also anticardiolipid antibodies, antiphospholipid antibodies. These are involved in coagulopathies, people who have bleeding tendencies or coagulation. So those are sometimes used to treat, to diagnose, and to follow the different levels of disorders. Autoimmune disorders can also attack your lungs. Sarcoidosis is a very common disease. It's a granulated, non-caseating granulomas that form in the lungs, but they can form on the skin, in the sinuses, in the eyes, in the musculoskeletal, abdominal. So they could have many presentation, or just in the lung because the patient has a dry cough or something. You may go after it. You may see a bilateral fullness of the hilum, and you may do a angiotensin converting enzyme level and see whether it's elevated or it's not, and you may go for a biopsy. Sometimes it is, you worry that this may be cancer, and it may just be an autoimmune disorder. Other diseases that could be affecting multi-organs. So you could have a kidney and you could have a lung together, or you could have, as I said, in the lung, it is becoming more and more and more common to have autoimmune lung diseases that causes pulmonary hypertension, and it leads to the patient's demise. Unfortunately, it's very difficult to control. There are other forms of autoimmune disorders. Amyloidosis, or depositing of certain amyloid in muscles, in the kidney, in the heart, and other areas of the body that take away from the function of that digestive or that cardiac or that liver or that kidney organ. We have other autoimmune disorders like Henoch-Schönlein purpura, which is associated with strep, post-strep vasculitis. It's affecting, it comes in with purpuras, with arthritis, abdominal pain, renal diseases, and we have a variety of different. One of the ones that is associated also with cancer is myositis. Whether it's dermatomyositis or polymyositis, there may be a concurring cancer brewing somewhere that the patient is presenting with skin manifestations, and it needs to be looked at. So every rash is not to be treated and treated and treated and treated, and if it's not treated with something else, but sometimes we have to try to find the underlying reason for it as well. Thank you very much. The rest of it for later.